If you are over 60 and your doctor has told you that your blood pressure is creeping up, or that you are borderline, or that you need to watch it before the next step becomes medication, I want you to hear something that most people in that position never hear clearly enough. What you eat every single day is not a background detail in your blood pressure story. It is the main event. And there are 5 specific foods that are sitting in grocery stores right now, foods that your body can absorb and use within hours of eating them, that have more clinical evidence behind them for lowering blood pressure in adults over 60 than most people realize. I'm Dr. Serena Blake, and I have spent years watching patients in their 60s and 70s make meaningful, lasting changes to their blood pressure numbers without touching a single prescription pad, simply by understanding what their cardiovascular system actually needs and giving it exactly that. Today, I want to walk you through those 5 foods, why each one works inside the body at the level of the blood vessels and the kidneys and the nervous system, how to eat them correctly to get the maximum benefit, and what the research actually says, so that you are not taking my word for it, but understanding the evidence yourself. Because knowledge that you understand is the kind you actually use. Please subscribe before we begin for senior health guidance that goes deeper than the standard advice. Let me start with Patricia. Patricia was 67 and had been told at her last physical that her blood pressure had climbed to 144/88. Her doctor had given her 3 months to make lifestyle changes before revisiting the question of medication. Patricia had walked out of that appointment feeling overwhelmed. She had heard the advice before: less salt, more exercise, lose some weight. She had tried those things in a general, unfocused way and had not seen much change in her numbers. What she had never been given was specific information about which foods to prioritize and why, about the precise biological mechanisms that made certain foods capable of addressing the root causes of elevated blood pressure, rather than just providing vague general nutrition. 3 months later, Patricia came back to her appointment. Her blood pressure was 126/78. She had not started medication. She had not done anything dramatic. She had added 5 specific foods to her daily diet in deliberate, consistent ways, and her cardiovascular system had responded in exactly the way the research predicted it would. Her doctor asked what she had done. She told him. He wrote it down. I want to give you what Patricia was given. Not a general eat healthier message, but a specific, mechanistic, evidence-grounded explanation of 5 foods and what they do inside the body of a person over 60. The first food is beetroot, and specifically fresh beetroot juice. Not canned beets packed in vinegar, not beet chips from a snack aisle, but raw beetroot juiced or blended, or alternatively, the concentrated beetroot juice products sold specifically for cardiovascular support. The reason beetroot occupies the top position on this list has to do with a molecule called nitric oxide, and understanding nitric oxide is perhaps the most important thing a person over 60 can learn about their blood vessel health. Your blood vessels are not passive pipes. They are dynamic, muscular tubes lined with a thin layer of cells called the endothelium. And the endothelium's job is partly to regulate how wide or narrow the blood vessel stays at any given moment. Nitric oxide is the primary signaling molecule that tells the smooth muscle in your blood vessel walls to relax and dilate. When nitric oxide levels are adequate, your blood vessels open appropriately. Blood flows with less resistance, and blood pressure stays lower as a direct mechanical result. When nitric oxide is insufficient, as it consistently becomes after 60, because the enzymes that produce it become less efficient with age and because oxidative stress damages the endothelium, blood vessels become stiffer and narrower and pressure rises. Beetroot is extraordinarily rich in dietary nitrates. When you consume beetroot, the nitrates are absorbed in the small intestine and then a remarkable 2-step conversion occurs. Bacteria in your saliva convert the nitrates to nitrites, and then in the stomach and bloodstream, those nitrites are converted to nitric oxide. The result is a direct, measurable increase in circulating nitric oxide that relaxes the blood vessel walls and produces a reduction in blood pressure that can be measured within 2 to 3 hours of consumption. Multiple randomized controlled trials have demonstrated systolic blood pressure reductions of between 4 and 10 millimeters of mercury from regular beetroot juice consumption, which is in the range of effect of some low-dose antihypertensive medications. The practical application is this: 250 milliliters of fresh beetroot juice daily, which is roughly 1 standard glass, is what the majority of clinical studies have used. Beet It Sport, which is a concentrated beetroot shot sold at Holland & Barrett, Whole Foods Market, and Amazon, delivers the nitrate equivalent of a full glass of beetroot juice in a 70 milliliter shot and is one of the most commonly used products in the research literature. If you prefer to make your own, a single medium raw beetroot blended with water or a small amount of apple for palatability delivers a comparable nitrate dose. Avoid using antiseptic mouthwash before or during beetroot juice consumption because mouthwash kills the saliva bacteria that perform the critical first step of the nitrate to nitrite conversion, eliminating the blood pressure benefit entirely. Now let me tell you about Thomas, because his story leads directly into the second food on this list. Thomas was 71, had elevated blood pressure, and also had a family history of heart disease that kept him vigilant. He had always eaten what he considered a reasonable diet, but had been told by 2 different physicians that his potassium intake was probably too low, something he had never paid much attention to because he did not fully understand why potassium mattered for blood pressure. When a dietitian finally explained the sodium-potassium relationship to Thomas in specific terms, he said it was the first time any piece of nutritional advice had ever made complete logical sense to him. And from that day forward, he applied it with the kind of discipline that came from actual understanding rather than vague instruction. The second food is the banana, but the reason it matters goes far beyond the popular knowledge that bananas have potassium. To understand why potassium specifically lowers blood pressure, you need to understand the mechanism behind what sodium does to raise it. Sodium is managed in the body primarily by the kidneys, which use a sodium-potassium pump in the cells of the kidney tubules to decide how much sodium to reabsorb into the bloodstream and how much to excrete in the urine. When sodium intake is high, the kidneys reabsorb more of it, water follows the sodium, blood volume increases, and blood pressure rises as a direct result of having more fluid pressing against the walls of the vessels. Potassium directly counters this mechanism. Higher potassium levels in the bloodstream signal the kidneys to excrete more sodium, which draws water out with it, which reduces blood volume, which reduces pressure. This is not a metaphorical or indirect relationship. It is a direct biochemical competition at the kidney level between 2 electrolytes, and the research consistently shows that increasing potassium intake produces blood pressure reductions that are comparable in magnitude to reducing sodium intake. The 2 interventions together, increasing potassium while reducing sodium, produce effects that are additive and often dramatic. A medium banana contains approximately 422 milligrams of potassium. The adequate intake guideline for potassium is 2,600 milligrams per day for women and 3,400 milligrams per day for men, and most adults in Western countries consume considerably less than either of those targets. 2 bananas daily, incorporated consistently, contribute meaningfully to closing that gap. But potassium is not only in bananas, and for people who find daily banana consumption monotonous, the same potassium loading principle applies to sweet potatoes, which contain over 500 milligrams per half cup cooked, to white potatoes with the skin left on, to spinach, to avocado, and to lentils. One critical caution applies here, and I want to be very direct about it. If you are taking potassium-sparing medications, including spironolactone, amiloride, or eplerenone, or if you are taking ACE inhibitors such as lisinopril or ramipril, or ARBs such as losartan or valsartan, significantly increasing your potassium intake through dietary changes requires a conversation with your physician first. These medications already raise potassium levels by their mechanism of action, and combining them with high potassium foods can drive potassium to levels that affect heart rhythm in ways that are serious. For people on none of these medications, increasing potassium through whole food sources is safe, evidence-based, and one of the most powerful dietary levers available for blood pressure management. The third food is dark chocolate, and I want to address the immediate skepticism that statement typically generates because it is entirely understandable. When patients hear that chocolate belongs on a blood pressure list, they assume I am talking about the milk chocolate they have been eating their whole lives, the highly sweetened, cocoa-diluted product that constitutes the majority of chocolate sold in supermarkets. I am not. What the research consistently points to is dark chocolate with a minimum cocoa content of 70%, and the biological mechanism is fundamentally different from anything milk chocolate delivers. High cocoa dark chocolate is rich in a category of plant compounds called flavonols, specifically epicatechin and catechin, and these flavonols do something remarkable in the blood vessel endothelium. They stimulate the same endothelial nitric oxide synthase enzyme that produces nitric oxide, by a different pathway than beetroot, but with a similar end result. More nitric oxide, more blood vessel relaxation, lower peripheral resistance, lower blood pressure. Multiple meta-analyses of randomized controlled trials, including a comprehensive 2012 analysis published in the Cochrane Database of Systematic Reviews covering studies involving more than 800 participants, found that flavanol-rich cocoa products produced consistent reductions in blood pressure of approximately 2 to 3 millimeters of mercury on systolic readings and approximately 1 to 2 millimeters on diastolic readings. Those numbers are modest on their own, but become significant when layered with other dietary interventions. The practical application requires specificity. Lindt Excellence 85% Cocoa Bar, which is available at most major supermarkets including Kroger, Safeway, Publix, and Target, contains a high enough cocoa flavanol content to deliver the studied benefit. The same applies to Green and Black's organic 85% dark chocolate, available at Whole Foods Market and most natural food retailers. The daily serving studied in the majority of relevant trials is between 10 and 30 grams, which is roughly 1 to 3 squares of a standard chocolate bar. The key is consistency and cocoa percentage. A 70% bar consumed daily delivers meaningful benefit. A milk chocolate bar consumed at any percentage does not. The fourth food is the one that generates the most genuine surprise in clinical conversations, and it is one that most people over 60 already have in their kitchens, but have never thought of as a cardiovascular intervention. It is ground flaxseed, not flaxseed oil, not whole flaxseed. Ground flaxseed, also called flaxseed meal, which is sold at Trader Joe's, Whole Foods Market, Walmart, and most grocery stores under the Bob's Red Mill brand, among others. Let me tell you what flaxseed does in the body, because the mechanism is layered, and each layer independently contributes to blood pressure reduction. First, ground flaxseed is among the richest plant sources of alpha-linolenic acid, which is an omega-3 fatty acid. Omega-3 fatty acids reduce the production of pro-inflammatory molecules called prostaglandins and thromboxanes that contribute to blood vessel constriction and increased peripheral resistance. They also improve the elasticity of blood vessel walls, which stiffens with age and is one of the primary drivers of the isolated systolic hypertension that is most common in adults over 65. Second, ground flaxseed contains lignans, a category of phytoestrogens that have been shown independently to reduce systolic blood pressure through mechanisms involving the endothelium and the renin-angiotensin system, which is the same hormonal system that ACE inhibitors and ARBs target pharmacologically. Third, the soluble fiber in ground flaxseed slows gastric emptying, moderates blood sugar response, and has its own independent modest blood pressure lowering effect through mechanisms related to gut microbiome health and short-chain fatty acid production. The 2013 Flax Dashpad trial, published in the journal Hypertension, remains one of the most compelling pieces of evidence in this area. In that trial, patients with peripheral arterial disease who consumed 30 grams of milled flaxseed daily for 6 months showed systolic blood pressure reductions of 15 millimeters of mercury in those who had systolic readings above 140 at baseline. That is a clinically meaningful reduction of the magnitude achieved by pharmacological intervention. More recent meta-analyses have been somewhat more conservative, but consistently show meaningful systolic and diastolic reductions from regular ground flaxseed consumption in hypertensive adults. The practical application is straightforward. 2 tablespoons of ground flaxseed daily, which is approximately 15 grams, is the minimum dose at which the research shows reliable benefit. 30 grams, which is 4 tablespoons, is the dose used in the most dramatic trial findings. Ground flaxseed has a mild, nutty flavor that blends invisibly into oatmeal, yogurt, smoothies, and soups. It should be stored in the refrigerator after opening because the omega-3 oils oxidize quickly at room temperature. Whole flaxseed passes through the digestive tract largely undigested, which is why ground flaxseed or flaxseed meal is specified. Now let me return to Patricia for a moment because the fourth food on this list is the one she later told me made the most visible difference in her readings in the shortest period of time. She had been skeptical. She had told me that she associated seeds with health food stores and with a kind of nutritional zealotry that felt remote from her actual life. But she had added 2 tablespoons of Bob's Red Mill flaxseed meal to her morning oatmeal every day for 6 weeks, and she told me the pattern of her readings had shifted noticeably within the first 2 weeks. I did not promise her a specific result. The biology of blood pressure is individual, and the response varies, but the mechanism is real. The research is solid, and for Patricia, it worked faster than she expected. The fifth food is the one with the deepest and most ancient relationship to cardiovascular health, and it is also the one most frequently dismissed because it has become culturally familiar to the point of invisibility. It is garlic, and specifically raw garlic, or the aged black garlic preparations that have been the subject of considerable clinical research over the past 2 decades. Garlic's blood pressure mechanism centers on a compound called allicin, which is produced when a garlic clove is crushed or chopped, and the enzyme alliinase acts on the precursor compound alliin. Allicin and its downstream metabolites have multiple cardiovascular effects. They inhibit an enzyme called angiotensin-converting enzyme, which is the same enzyme that ACE inhibitor medications like lisinopril target. By inhibiting this enzyme, allicin reduces the production of angiotensin II, a potent vasoconstrictor that raises blood pressure by narrowing blood vessels and stimulating the kidneys to retain sodium. Allicin also acts directly on smooth muscle cells in blood vessel walls through hydrogen sulfide signaling pathways, producing relaxation and dilation independent of its ACE inhibition effect. And it has antioxidant properties that reduce the oxidative damage to the endothelium that is one of the primary drivers of arterial stiffness in older adults. A 2016 meta-analysis published in the Journal of Nutrition examined 12 randomized controlled trials involving 553 participants with hypertension and found that garlic supplementation produced an average systolic blood pressure reduction of 8.3 millimeters of mercury compared to placebo, and a diastolic reduction of 5.5 millimeters of mercury. Those are numbers that would be clinically significant for any single intervention, and for a food rather than a pharmaceutical, they represent an effect size that deserves far more attention than garlic typically receives in clinical conversations about blood pressure management. The practical challenge with garlic is palatability and consistency. Raw garlic eaten daily in therapeutic doses, which the research suggests is in the range of 2 to 4 fresh cloves per day, is socially demanding and gastrointestinally challenging for many people. Crushing the cloves and allowing them to sit for 10 minutes before cooking preserves a substantial portion of the allicin even through gentle heat, and incorporating garlic into daily cooking in olive oil with vegetables, in soups, in grain dishes, provides a consistent daily dose that accumulates real benefit over time without requiring the consumption of raw cloves at breakfast. For those who find dietary garlic impractical at the doses required, aged garlic extract is the supplemental form with the strongest clinical evidence. Kyolic aged garlic extract, available at Costco, Amazon, and most health food retailers, has been used in multiple clinical trials specifically examining blood pressure outcomes and has shown consistent results across populations. The standard dose used in the blood pressure trials is 2 to 4 capsules daily, containing a total of 1,200 to 2,400 milligrams of aged garlic extract. I want to bring these 5 foods together now because the most important thing to understand is that their mechanisms are additive and in some cases synergistic. Beetroot and dark chocolate both raise nitric oxide through different enzymatic pathways, and their effects on blood vessel relaxation compound each other. Potassium-rich foods and flaxseed both work partly through the kidney and the renin-angiotensin system, and their combined effect on sodium excretion and fluid balance is greater than either alone. Garlic's ACE inhibition complements the potassium-sodium mechanism by reducing the hormonal signal that drives sodium retention in the first place. This is not 5 random foods that are each a little good for you. It is a coherent dietary strategy that addresses blood pressure through 5 overlapping biological pathways simultaneously, which is precisely the reason it can produce results that surprise both patients and physicians. Let me also tell you what not to do when starting this approach, because the most common mistake I see is an all-or-nothing response that is impossible to sustain. People hear a list of 5 foods and either try to incorporate all of them perfectly on the first day, fail to maintain the standard, and abandon the effort, or they focus exclusively on one food while ignoring the others and wonder why the results are limited. The approach that produces lasting results is incremental and systematic. Add one food for 2 weeks until it becomes automatic. Then add the second, then the third. By week 10, you have built 5 habits that feel natural rather than one overwhelming transformation that felt forced from day 1. The second mistake is adding these foods without reducing the inputs that are working against them. Ground flaxseed will not fully overcome a sodium intake of 3,500 milligrams per day. Beetroot juice will not override the effect of a diet built on processed foods in which almost every ingredient contains added sodium. These 5 foods work best as part of a general dietary direction that is moving toward whole foods, adequate potassium, and reduced processed food sodium, not as isolated additions to an otherwise unchanged diet. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is the dietary framework most supported by the clinical evidence for blood pressure management, and these 5 foods fit naturally and completely within it. I also want to address the question that I know is forming in the back of your mind. Does this mean you do not need medication? The answer is nuanced, and I want to give it to you honestly. For people with mildly elevated blood pressure in the range of 130 to 145 over 80 to 90, with no other cardiovascular risk factors and no organ damage, dietary intervention of the kind I have described has genuine potential to normalize blood pressure without pharmacological support, and the clinical evidence supports attempting this approach before adding medication when the clinical situation permits it. Patricia is a real example of that outcome. For people with more significantly elevated blood pressure, with established cardiovascular disease, with kidney involvement, or with multiple risk factors, medication may be necessary regardless of diet, and the role of these 5 foods is to work alongside medication, reducing the dose required to achieve control and addressing the underlying vascular biology that medication alone does not fully correct. In those cases, the goal is not to eliminate medication, but to reduce its burden and optimize the health of the cardiovascular system that the medication is protecting. And for people already on medication, I want to say something important. Do not adjust your medication based on improved readings from dietary changes without discussing it with your physician. If your blood pressure improves significantly after incorporating these foods, that is exactly the kind of clinical data that should prompt a medication review with your doctor. The improved reading is evidence. Bring it to the appointment with the dates and the dietary changes clearly noted, and let your prescriber evaluate whether a dose reduction is appropriate. That conversation, backed by 30 days of improved readings, is far more likely to result in a meaningful clinical adjustment than any amount of self-management done in silence. What I want you to leave this conversation with is not a shopping list. It is an understanding. Beetroot juice works because your blood vessels need nitric oxide, and age reduces its production. Potassium-rich foods like bananas and sweet potatoes work because your kidneys respond to potassium by releasing sodium and fluid. Dark chocolate with 85% cocoa works because its flavonols stimulate the same nitric oxide pathways through a different route. Ground flaxseed works because its omega-3 fatty acids, lignans, and soluble fiber address arterial stiffness, hormonal vasoconstriction, and gut cardiovascular signaling simultaneously. And garlic works because allicin inhibits the same enzymatic pathway that some of the most commonly prescribed blood pressure medications target, while also directly relaxing blood vessel smooth muscle. 5 foods, 5 mechanisms, one coherent biological strategy for a cardiovascular system that has been working for 60 plus years and deserves to be given the specific inputs it needs to keep working well. Take care of yourself, start with one, and build from there, and I will see you in the next video.